Welcome to the racial trauma of climate change. This is the sixth webinar in a series hosted by the Medical Society Consortium on Climate and Health. The series is part of a Climate and Health Equity Fellowship, a program conducted in partnership with the National Medical Association's Southeast region to support the leadership of physicians of color in equitable climate and change and health. This includes policy development, community education, and advocacy. I am Dr. Kimberly Williams, the program manager for the fellowship. Also joining me from the consortium to run the webinar is Bev Harp and Clarissa Payton. They are available through the chat to answer any technical questions during the webinar. This series of webinars is held for 1 hour on the second Friday of each month from 3 to 4 p.m. Eastern. Today's webinar is recorded and made available on our website for future viewing. As many of you know, historical displacement, disenfranchisement, and exploitation have put many communities of color in the direct path of the climate crisis. Climate change magnifies the underlying stressors of racism and poverty, both of which have documented acute physical and mental health impacts. This unique form of trauma is called racial trauma. When climate disaster strikes, the mental health consequences on top of racial trauma are often more severe. Today, we are honored to have with us Dr. Annelle Primm. Dr. Primm chairs All Healers Mental Health Alliance, a group of mental health professionals, faith leaders, first responders, and public health advocates that facilitate culturally aligned responses to the mental health needs of marginalized communities that have been affected by natural and human-caused disasters. Dr. Primm was formerly director of the Johns Hopkins Hospital Community Psychiatry Program, followed by leadership roles at the American Psychiatric Association. Rather than use our time to provide further description of Dr. Primm's impressive accomplishments, we are placing a link to her bio in the chat. We are appreciative of her time and expertise in sharing with our community of climate and health advocates. The general format for today's webinar will be a 40-minute presentation from our speaker, followed by 15 minutes of question and answers from you, our audience. We ask that you put any comments, links to resources that you recommend, or questions that you have for our presenter in the chat box at any time during the presentation. We will get to as many of the questions as we can during the Q&A period. As a reminder, please keep yourself muted so that we are not interrupted by background noise. Dr. Primm, you may begin.
Thank you, Dr. Williams, and I will share my screen now. Okay, hopefully everyone can see that. And good afternoon, everyone. It's my pleasure to be here to speak with you today about racial trauma of climate change in communities of color. And one aspect that I'd like to focus on is maximizing mental health in communities of color in the aftermath of natural disasters from Katrina to the present. Communities of color are vulnerable to disasters, and this is driven largely by climate change. They tend to live in higher risk areas, and very often this is a result of environmental racism, which has relegated members of communities of color to some of the least desirable areas from a disaster-prone perspective. it's very important to be conscious of what some of the pre-existing and multi-layered adverse social determinants of health and social determinants of mental health that show up in terms of, less resources to prepare and more difficulty in recovering from disasters. All of this taken together really leads to trauma in the form of racial trauma, psychological distress, social isolation, depression, anxiety, loss, grief, and hopelessness, and so much more. This is a quote from Bernadette Onyenaka from the National League of Cities, who said that racial equity may not seem like an obvious piece of the puzzle of emergency preparedness, but the research paints a different picture. Studies show that every disaster disproportionately and permanently disrupts the lives of those with the least resources to withstand disaster. Before I go into more detail on disaster specifically, the organizers really wanted me to talk about adverse childhood experiences. Some of you may be familiar with this. Certainly, disasters can contribute to the adverse childhood experiences of young people, but I'd like to define this. ACEs, as they are also called, are traumatic events occurring in childhood, usually from 0 to 17 years old. They're commonly the experience of violence, abuse, or neglect, witnessing violence in the home or in community, having a family member attempt or die by suicide, and really any environment that undermines the safety, the stability, or the bonding of a young person, as evidenced by parents or caregivers who have substance use disorder, mental health problems, and certainly parental separation can have an impact and really serve as an adverse childhood experience. And unfortunately, for communities of color, having a household member being in jail or prison is an all too common occurrence, given mass incarceration that has occurred among communities of color in our nation. Adverse childhood experiences are linked to chronic diseases, mental health concerns, mental illness, substance use problems in adulthood. And also, adverse childhood experiences can have a negative impact on education, on employment, and also earning potential. ACEs are very common. 60% of adults, 61% of adults have experienced at least one ACE, and nearly 1 in 6 reported 4 or more adverse childhood experiences. Women and people of color, they experience disparities in the number of ACEs that they experience. They are more likely to experience 4 or more types than people of other gender and racial groups. If we think about the accumulation of ACEs and the subsequent toxic stress, we find that there is a strong correlation with unfavorable health outcomes in adulthood. And when we think about the cumulative exposure to adversity, it really causes, it really is essentially a toxin in the development of children, and this can affect their ability to be attentive. It has an impact on their decision-making and executive function, their learning, their response to stress, and it also portends difficulty establishing and maintaining healthy and stable relationships. Some of you may recognize some of this language in the last bullet at the end. These are the very aspects of what mental health is. The ability to remember, to learn, to adapt with change and cope with stress, and the ability to have productive and fulfilling relationships. So the ACEs can have indeed a very significant impact on mental health in adulthood among children who have been affected. But fortunately, this statement, risk factors are not predictive factors because of protective factors, is true. And this is a saying that the former Surgeon General, Dr. David Satcher, and one of my colleagues and mentors, the late Dr. Carl Bell, always emphasized, and certainly the importance of prevention and taking a public health approach. We can prevent ACEs by creating safe, stable, and nurturing environments for children and families, strengthen household financial security, as some of the steps that have been taken by the Biden administration recently, and ensuring a strong start for children, such as with Head Start and other similar programs. A real critical aspect of preventing and ameliorating the adverse childhood experiences is connecting young people to caring adults, this concept of adult protective shield. And that's very important to remember, even when young people have been subjected to adverse childhood experiences, having a caring adult in their lives. And it doesn't have to be a biological parent. It could be a teacher, a mentor, a coach, another close relative or family friend. So these are important things to remember when it comes to the trauma and the toxic stress associated with adverse childhood experiences. So I'm going to shift now to talking about what some of the critical elements in maximizing mental health post-disaster. And Hopfall, Watson, and Bell, and in fact, this is Dr. Carl Bell, who I just referred to, and other colleagues did a meta-analysis of numerous studies and found, what is really the essence of maintaining mental health in the aftermath of disasters. And these are the 5 things that they came up with that were the most critical factors. Creating a sense of calm, creating a sense of safety, fostering and promoting self and collective efficacy, giving people a sense that they can do some things for themselves, even in the aftermath of disasters when they've lost a lot or their environment is completely changed and disrupted. They can still establish and maintain certain routines, and they can also join with their neighbors and members of their family to have collective efficacy, meaning that they can join together to do things collaboratively. This helps to offset some of the trauma and the stress associated with disasters. And then also being connected. Being isolated in the aftermath of a disaster is certainly not a recipe for mental health, given that humans are relational creatures. And so having a sense that one is connected and not alone is another important factor. And of course, a hope, giving people a sense that things can and will get better with time is a very important component of maximizing mental health post-disaster. Some of you may recognize some of the elements that I just talked about really are a part of what psychological first aid is, which is a very helpful approach in the aftermath of disasters, which includes, listening, comforting, connecting, protecting, and instilling hope. And while we're on the subject of hope, I think there's a connection to spirituality. The Reverend Dr. Willard Ashley, who is a psychoanalyst and a Baptist minister, who has been very active in responding to disasters, including 9/11 and Hurricane Katrina. This is his definition of spirituality, that is belief in or relationship with a higher power. He sees spirituality as an aspect of life that gives purpose, meaning, direction, and this may encompass religion, but it may not necessarily include religion. People can engage in spirituality without belonging to any particular religious group. Spirituality also suggests a connecting force or an integrating power that unifies all aspects of life, families, friends, communities, and also provides energizing direction and order. Dr. Ashley sees that everything is tied together by spirituality, which gives meaning and sense to things and gives meaning and sense to life. This reminds me of a South African concept called Ubuntu, which means I am because we are. And that really embodies some of the spiritual sense as described here. Dr. Ashley and his colleague, Rabbi Stephen Roberts, edited a book called Disaster Spiritual Care, Practical Clergy Responses to Community, Regional, and National Tragedy, which I highly recommend, which really gives voice to some of the ways in which religious leaders and spiritual leaders and those concepts can play a role in helping people heal and thrive in the aftermath of disasters. So now I would like to tell you about the All Healers Mental Health Alliance, really as a response to the racial trauma that people of color have experienced in the aftermath of natural disasters, many of which were brought about by climate change. And this is a group of psychiatrists, faith-based leaders, social workers, psychologists, nurses, first responders, and other community leaders and individuals that facilitates culturally grounded long-term responses to the mental health needs of marginalized communities in the aftermath of both natural and human-caused disasters. This organization, also known as AMHA, was formed immediately after Hurricane Katrina in 2005, and that makes us almost 16 years old as of later on this month at the anniversary of Katrina. And it was really inspired by former NMA president, National Medical Association president, Dr. Lucy Perez, who at the time was the health director of the NAACP. And she called me and said, we've got to do something. We were all watching television, seeing people suffering in misery in the aftermath of Hurricane Katrina. And we realized we couldn't drop everything and go running to New Orleans and to the Gulf Coast, but we figured there was something that we should be able to do. The next phone call I made was to the late Dr. Phyllis Harrison Ross, who's a noted child psychiatrist based in New York City. And we decided that we were going to work together to strategize to really, even though we couldn't directly intervene in this disaster, that we felt that we could facilitate some sort of supportive responses to the communities that were affected. We were initially situated under the New York Society for Ethical Culture in New York City, and this was through Dr. Harrison Ross's connection with that faith-based institution. And in 2018, All Healers Mental Health Alliance became an independent organization. And so you might ask, what does the All Healers Mental Health Alliance do? It convenes monthly forums for information exchange, resource sharing, strategizing, developing technical assistance for problems, local problems engendered by disaster, and that are often associated with the lack of support that communities of color receive in the aftermath of disasters. And over these 16 years, we have been able to mobilize collaborations to promote healing and thriving and to coordinate services of support for disaster-affected communities, caregivers, and first responders. The All Healers Mental Health Alliance partners have included over 50 leaders in over 25 states and US territories who are associated with national, largely Black organizations, local affiliates and chapters, and academic institutions, including historically Black colleges and universities, faith communities, nonprofit organizations, and even small businesses. So it's very much a multidisciplinary group, not only including health professionals and mental health experts, but also business leaders, engineers, and people with all sorts of backgrounds. So why is a collaboration like this necessary? As you all know in this audience, due to climate change, natural disasters are occurring more frequently. And we know that communities of color are hit harder by disasters more than other communities because of some of the pre-existing economic and other disparities and inequities that have existed in our country for centuries, especially as it relates to the Black community. These communities are often neglected and receive unequal treatment from emergency response services. And also, still today, there is a glaring lack of racial diversity in the leadership among disaster and emergency management professionals. And this is one of the main drivers of disparate disaster response in marginalized communities. Also, we have found that disaster organizations typically take a one-size-fits-all approach, which is not helpful. And in many cases, we have witnessed where disaster organizations have even looked down upon communities of color who needed their assistance. So all of these things really underscored why an organization like the All Healers Mental Health Alliance needed to exist. Also, we have come to the realization that communities of color must become their own solution, as no one else may come to their rescue or fully understand their culture or the true extent of their needs and the gravity of their needs. This reminds me of a quote from Dr. Kamara Phyllis Jones, the former president of the American Public Health Association. She has said that inaction in the face of need is the hallmark of structural racism. And certainly when it comes to disasters in the aftermath of natural disasters resulting from climate change, this has very much been the situation and has driven our group to really step up and take action in supporting communities of color. So I'd like to really give you an illustration of the different ways in which AMHA has established or helped to establish mental health or maximize mental health in the aftermath of disaster by talking about a number of things which I consider our best practices. First and foremost, it is critical to foster a ministry of presence. And some of you may have heard of this concept before, but showing up and being there. And one thing that we have done well is to convene healers of various disciplines and backgrounds, from mental health and human services disciplines, for a disaster training in a New York City church after Superstorm Sandy. These groups and these organizations that came together after Superstorm Sandy decided to adopt some of the most hard-hit communities to bear witness to their hardship, to report to FEMA on their needs, and to provide direct support. So that showing up, we came together and then fanned out to really engage the communities in need. And so that gives communities a sense that they have not been forgotten and that somebody cares. This played out also in our work after Hurricane Florence, in which we mobilized social workers, psychologists, psychiatrists, psychologists, and medical students to provide healing services in churches, basically to engage the people who had been hit by these horrible floods that Hurricane Florence brought. These were places like Lumberton, North Carolina, Chinquapin, and Trenton. These are largely rural areas The storm damage to these families was extremely significant. And by engaging with the individuals in the church setting as a part of a health fair that was held after Hurricane Florence, we were able to give hope, to listen, to hear their stories. And all of this is very therapeutic. And I need to underscore that, you know, even though I'm a community psychiatrist, this is not psychiatry. This is really community mental health, you know, applied in the disaster setting. Some of the help that we provided would not be considered really even mental health typically, but it was important to show up and to be present to help people, you know, do things like clean out the debris from their flooded homes. And we did this as well for seniors who are living alone and who were affected by Hurricane Florence. So I think you get the picture, the importance of the ministry of presence. Also, providing access to resources that we had gathered was also very important. And while we focus on mental health largely, helping to provide for basic needs of people is so critical because, you know, I think the last thing a person wants to hear about is, you know, a psychiatrist coming to the rescue, and what they need is a place to stay or other material comforts. And so those basic needs need to be met. And certainly this was the case in Port Arthur, Texas, after Hurricane Katrina hit. And we were fortunate to be able to connect some of the community leaders from Port Arthur who had been overlooked and hadn't had any contact with FEMA. We were able to connect them with FEMA to make sure that their neighbors received disaster relief. We also gathered and delivered supplies and donations to family in need after Hurricane Florence in North Carolina, after Hurricanes Irma and Maria in the US Virgin Islands, and also in Texas after Hurricane Harvey. We've also participated in direct disaster relief. And again, following Superstorm Sandy, when we coordinated with various organizations, the New York City Association of Black Psychologists, the New York City Association of Black Social Workers, the Black Psychiatrists of America, New York chapter, we came together and actually adopted some of the hardest hit, very diverse communities of Coney Island and Canarsie in Brooklyn, and then in Far Rockaway in Queens. Some of these are very remote areas, and they were just, you know, decimated after Superstorm Sandy. And we, groups of organizations adopted these areas, connected with some of the faith communities there that were providing assistance to some of the residents of those boroughs of New York City. And they did all sorts of things. They held healing circles, there were health fairs, they taught people how to clean their homes and rid it of mold after flooding in their homes. They created opportunities for recreation for the children who, as you can imagine, were extremely frustrated and bored, having to deal with a completely altered home life. And so, you know, all of these things, you know, indirectly address the mental health needs of the community. We also interfaced with the National Medical Association, Region 2, and Dr. Linda Walden, who may be on this line. She was one of the physicians that we engaged with in our efforts to be supportive of the Florida Panhandle after Hurricane Michael. We also engaged with local faith leaders, to facilitate delivery of needed resources. So our interventions and supports took on many forms. Another important concept and what we call best practice is to engage scouts on the ground. And we were fortunate to partner with a network of churches and communities in the South to orchestrate delivery of truckloads of foods and other essential supplies to communities such as Port Arthur, in Texas through the work of Unity in Disaster. Unity in Disaster is not a mental health organization. It's an organization led by an Air Force veteran who was really called to this work. And after disasters, through the relationships that he's developed over time with organizations like NVOAD, the National Volunteer Organizations active in disaster, to actually get truckloads of goods and foods and so forth to deliver them across the nation. And so we have teamed up with him and we've been able to get him to mobilize and serve many of the communities that we've engaged with. We've also regularly gathered data from our networks on the ground in the early days following disasters. And FEMA has recognized that we have this kind of relationship with communities of color and are able to provide them with information so that they can make sure that certain communities are not overlooked and make sure that certain resources and services can be directed to them. We've also found the importance of culturally grounded responses to disasters as being something really crucial. And an example of this is one of the churches in Lumberton, North Carolina that we engaged with. We were able to help support them in providing warm meals of familiar food that people were used to eating, like chicken and rice and collard greens, whereas across the street at the Red Cross shelter, they were offering only cold sandwiches. So, of course, cold sandwiches is food and people should be grateful for food in the aftermath of an emergency like a flood disaster as Hurricane Florence was. But it just didn't give people that, good old down home warm feeling that they were looking for. And that really added to their comfort. And so, understanding some of the cultural nuances like that is really critical to supporting people and maximizing mental health after disaster. Another realization that All Healers Mental Health Alliance had was about some of the, the cultural factors after disasters and making sure those are taken into account, including utilizing cultural brokers and promotoras for communities who can and serve as kind of go-betweens between disaster and emergency management professionals and the community. These are people who understand the community, they speak the language, they know the practices and preferred approaches to things. And so we were fortunate to add a section in the Red Cross's Disaster Mental Health Services Handbook in 2012. So responding to mental health needs post-disaster, we did do some of this, directly. And post-Katrina, we were fortunate to partner with the Morehouse School of Medicine to facilitate telemental health services in New Orleans in the very remote area of Plaquemines Parish. And you all must understand that this was not the video conferencing that we are so used to today, that we just at the drop of a hat, get on Zoom or engage with patients or people receiving services through DoxyMe and a whole number of different platforms. That did not exist in 2005. And, there was some technology, but we had some very basic rudimentary picture phones that you could plug into a fax line and actually visualize the individual. And so through the support of Morehouse, we were able to situate some of those picture phones with some of our clinicians and practitioners, and on the one end in different parts of the country, and then on the other end to have these picture phones in primary care settings and other settings around communities to facilitate communications and assessment of people who are in need of mental health services, or at least a mental health consultation for the primary care physicians and practitioners. We also organized healing circles and taught relaxation techniques to Katrina survivors in New Orleans, and convened support groups for seniors in Houston nursing facilities. These were people who were displaced by Katrina to Houston. And utilizing media and communications is also critical in the aftermath of disasters, especially serving communities of color. One example of how we utilized media was to provide an online training to crisis counselors who work for Vibrant. That is the company that kind of staffs the disaster distress hotline. And our original idea was to work with the U.S. Virgin Islands to establish its own disaster distress hotline for the people of the Virgin Islands, provided by, a group of people who is knowledgeable about the culture and what the mental health needs are and the situation on the ground. It was not possible to do that. But we were fortunate that Vibrant was willing to work with us to establish an online training for their counselors to learn from experts who were from the U.S. Virgin Islands themselves about what the mental health situation was there, as well as what some of the cultural factors and the historical factors were that would be important for a crisis counselor to know and understand. And so this was another way of achieving our goal of having more culturally appropriate and knowledgeable counselors engaging with the Virgin Islands community. We've also provided content for articles in the Black press and other socially conscious media outlets to raise awareness of the plight of communities of color affected by disasters. This is very important because there are times when there really wasn't much that we could do ourselves, even with our vast network of organizational connections and personal connections that we always bring to bear in the aftermath of a disaster. Sometimes the best thing that we could do to elevate the plight of the affected communities was to expose it in the media so that other people will know and so that people would not be suffering in silence. And so we see this as also an indirect mechanism for restoring mental health so that people, again, they know that they haven't been forgotten and that help is coming. We've also used online resources and social media to share culturally tailored disaster preparedness tools, such as a grab and go kit, which was developed by one of our colleagues, Dr. Sandra Moss Robinson, I would say a disaster psychiatrist who's worked in many disasters over the years and has been an amazing leader and collaborator with All Healers Mental Health Alliance. Critical point, promote care for the caregiver. If you don't focus on the caregiver who's actually serving the community that's disaster affected, it's very possible that they themselves will burn out and will not be able to continue the very important work of serving communities who've been hit with these disaster situations. And so what we've done historically from Hurricane Katrina to the present is to be able to provide support to community leaders in real time. And in this case, after Hurricane Harvey, a community leader in Port Arthur, Texas, was escaping Hurricane Harvey with his family and neighbors because the floods kept rising where he went, and he went from one shelter to the next, and his family was still in danger, and he decided to travel sort of in a caravan with vans to get to Louisiana. And so we actually took up a collection, got him and his family members and friends and neighbors hotel rooms to make sure that at least they could have a clean and safe place to stay, be able to take a shower, and also to, have a warm breakfast the next morning. And we ultimately connected them to FEMA as well, so that they could tap into some of the FEMA resources to get hotels going forward. We've also offered our monthly forums really as a healing space for community leaders and first responders who are doing this very hard and tiring work. Everyone is very much dedicated, but to be able to come to a space where people understand what it is that you're going through, whether you can get on the spot support and ideas for what to do when you feel stuck. This has been really critical for any disaster that we've intervened in, and not just the natural disasters like the hurricanes that I've spoken about, but even disasters like the Flint water crisis. And so we've encouraged the use of a healing toolkit that was developed by the Community Healing Network and the Association of Black Psychologists. And this healing toolkit contains, different exercises, different breathing and relaxation techniques, and different tips for how to stay grounded, no matter what sort of trauma or disaster is going on around you. It's also important to celebrate and to recognize those who have made tremendous sacrifices to intervene in disaster. And so we've held Heroes of Healing events where we've publicly praised community leaders who've served in disaster relief efforts after Hurricane Katrina and other disasters. And we've also hosted gatherings to bring people together to celebrate their accomplishments, and also to provide an opportunity for people to tell their stories publicly. And having these narratives and sharing them, there's a lot of healing in that. An example of this last bullet was during one of the Institute for Psychiatric Services conferences of the American Psychiatric Association back in 2017. And much of the program agenda was devoted to talking about, the Hurricane Katrina, its mental health impact. And at that time, we held, in conjunction with that conference, which was in New Orleans, gatherings of people from the community to engage with those of us who were visiting the conference as psychiatrists. And also it was an opportunity to, as I said, hold a Heroes of Healing event, to really honor those who had really given of themselves after that disaster. Creating platforms and exposure for disaster-related discussion focused on communities of color. An example of this was the conference that we hosted in 2019 to really focus on culturally informed responses to communities affected by both natural and human-caused disasters. And there were several panels on, everything from A to Z. And we've also participated in a number of radio shows and webinars, raising awareness about how to maintain mental health post-disaster. So I'm going to wrap up just with a few takeaways. Mental health and community well-being post-disasters and communities of color is really rooted and grounded when you're able to invoke a ministry of presence, connection, and meeting some of the basic needs that people have. And so this is not like bringing therapy or medication, even though some people may need and want that. And we've certainly been in a position to facilitate that, such as with our work in the US Virgin Islands, where we've worked with the Black Psychiatrists of America to get psychiatrists there, because most of them are retiring. And so we've been able to do that. But also interdisciplinary, collaborative, culturally syntonic approaches that ensure disaster response is comprehensive in addressing unmet needs, including mental health, especially for those communities that have experienced multiple successive disasters on top of the disparities and inequities that they experience, which revolves around race. And then finally, engaging local community leaders to develop strategies in a way that includes them and ensures that what is developed is culturally appropriate. And this really reminds me of that mantra, nothing about us without us. So with that, I will stop and thank you so much for your attention and look forward to your questions.
Thank you so much, Dr. Primm. That was an enlightening presentation. And your work, as you said, is not only helpful to the first responders, community leaders, but definitely beneficial to us as healthcare providers to help mitigate the mental health harms that our patients experience. And another key piece that I thought was important is that it's really important to ensure that the basic needs are met for our patients, and that really starts the healing mentally. So with that, we will take questions from the chat. Bev is handling the questions. Bev, do we have questions for Dr. Primm?
No, I see actually that we do. We had a couple questions before. I think I'll answer this one first, and then maybe David, you could actually go ahead and just ask your question out loud. I see you have your hand raised. But the first one we got in the chat, I think, was really about preparation. And it was a little more of a policy question, but I think even more broadly, what are the things that we can be doing in the health professional community and also as climate advocates to support and prepare communities, to lessen the impacts or to provide some buffer when disasters do happen?
Well, I think it's important that, first of all, that we as physicians and those of us in the healthcare community do not limit ourselves to only the one-on-one practice of medicine, one person at a time. I think that's how most of us were trained, but it is so critical to also think about populations and to think about the communities in which we sit and what those needs are. And so when a disaster occurs, getting involved and finding out, what are some of the barriers to people getting the help that they need. This might require that we, come out of our offices and hospitals and ivory towers and engage legislators and become advocates for changes in policies that may be getting in the way of communities getting what they need. Developing relationships with legislators and giving them ideas for the sorts of bills that they need to introduce to change policies, not only on the national level, but also on the state level, which is often where the rubber meets the road as it relates to disasters. What happens with the emergency management agencies of the various states. I mean, it really varies from state to state, and the state may get funding from FEMA, but it's the state that determines what they do with that. And so, making sure that communities of color are not forgotten. Another thing is to be vocal and to be visible, to write op-eds, to be interviewed in the print and electronic media and so forth. These are some of the things that physicians can speak out on as it relates to communities affected by disaster. I think we are still trusted citizens. And I think when we bring this message and really underscore, what the impact is to health and mental health and what changes need to be made in order to foster that, I think we can make some headway and have some impact in that regard.
Thanks so much for that answer. Definitely. I'm sorry if you can hear a cat meowing in the background. So another question in the chat was Dr. Paulson asked to just describe the grab and go kit in a little more detail. Just a quick question.
Yes, the grab and go kit is basically a backpack or something else, another sort of bag that a family would put in a convenient place that they could easily grab if they need to leave, need to evacuate due to an emergency or disaster situation. And in the grab and go kit would be things like, a driver's license or a copy of a driver's license, passport, pictures of family members in case people get separated, an amount of money in cash, since sometimes, if the electricity is down, people would not be able to use debit cards or credit cards for purchases, a flashlight, moist towelettes, masks for the whole family, because if you go to a shelter, there might not be masks or, might not be enough. And perhaps, important mementos that are small and that could fit into that backpack or whatever the carry bag is, perhaps a toy, a stuffed animal for a child to play with, that sort of thing. And of course, people could decide for themselves how they might want to vary what the recommended contents are. But this is really down to the basics and just for a quick grab and leave. And to have that ready, at all times is really the approach.
Yeah, I think actually, Kimberly, maybe we can drop the link into the chat. We're going to discuss this later on in our fellowship program with contents of what that kit could be. Dr. Pollack, if you want to go ahead and share your question, and then I'll go back to the chat.
Sure, I will. First of all, I want to thank Dr. Primm, who's a longtime friend and colleague of mine, and who everyone should recognize as a giant within the field of mental health for all she's done. Excellent presentation. I have two quick points. One from early on in your presentation that had to do with the adverse childhood experiences, and just to underscore how important it is for us to do the work to develop resilience approaches to counter those impacts. One finding that's been more reinforced of late in the last few years is that not only are these traumatic effects seen in relation to events that people experience, but also prenatal impacts. And some of these effects have what are called epigenetic impacts that can cause actual biological changes in the person's ability to respond to stress. So it really underscores how important it is for us to build a wall of resilience and support for those who are at risk of those kinds of things. The second point I want to make, which is, and I should underscore this by saying I represent both the American Psychiatric Association and the American Association for Community Psychiatry on the steering committee of the Medical Society Consortium, which is hosting this event, I believe. And I and my colleagues in the Climate Psychiatry Alliance have been doing a lot of work on educating people about these mental health effects that Dr. Primm has been underscoring. And one of the things that we've been talking about is the concept of transformational resilience. The idea of, as Annelle was emphasizing, we have to work at the community level to not only respond to acute disasters, but in the age of climate change, we're seeing both the repeated disasters that are battering people and making it much more difficult for them to recover. Look at what's happening with wildfires in Paradise in the Dixie area in California right now. But also just the slow-moving disaster of things like climate change and the impacts of sea level rise and repeated infectious disease outbreaks and heat. Here in the Northwest, I live in Portland, we're having our 5th climate-related disaster in a year. It's really hard on people. And the concept of transformational resilience focuses on how people need to be doing things to be more present, as Dr. Primm emphasized, and to have those presencing skills and to have purposing skills, the ability to both be aware of and ready to be grounded in these situations that we're in, and to be able to reach out, as in the examples you gave about Hurricane Sandy and other experiences around the country and elsewhere. So moving from working on individual people and their mental health, which is important, but more to the eco, from ego to eco, and how we need to develop prevention and resilience capabilities at the community level. There's actually a bill that's been articulated, it's being shopped around to various offices in Congress called the Resilience Act for Everyone 2021 that we'll see more about in the coming months, I hope. So thank you, Dr. Primm, for your presentation.
Thanks, David, for those comments. I agree, and really excellent to underscore those. Thank you.
Well, we really appreciate everyone for participating lively in this discussion. It has been great. Dr. Primm, we thank you so much for such an informative presentation, enlightening presentation, and we will be more present going forward. So thank you all again. We'd like you all to join us again next month. If you are interested, next month's webinar is scheduled for September 10th. Our topic is transportation. We encourage you to register if you are able. We'd like to continue answering the questions that you provided in the chat. Lana, I see you have a question. Please email those to us, and we will try to get those to Dr. Primm and follow up with with your answers and resources that Dr. Primm has provided to us. Before you leave, we will drop a survey into the chat. If you would take a moment to fill out the survey before you leave. Our sponsors, Johnson & Johnson, the Energy Foundation, and the Robert Wood Johnson Foundation for their generous support of the Climate and Health Equity Fellowship Program for this webinar series. This now concludes our session. We appreciate your time again. Thank you and have a good rest of your day.